For the axial calcaneus, what size IR do we use? 10 by 12. Length or crosswise? Lengthwise. What is our starting SID? 40. And then we have to angle how much? 40 degrees cephalic. Do we angle our tube first or drop first? Drop it. So if we're angling 40 degrees, how much are we dropping to?
32.
So 32. We're going to set our SID to 32. Angle 40 degrees. Where are we centering?
Base of the third.
So level of the base of the third metatarsal on the plantar surface. So if we find the base of her third metatarsal, follow it around her foot, we should be centered right about the same level. Okay, so we're going to change this just a little bit so we're centered. And we are going to come up just a little bit to be at the level of the base, the third metatarsal. Okay, so our CR and our part are aligned. What did we mess up? The IR. Good job, thank you. Good. So her foot is dorsiflex 90 degrees. We've got a marker, our right marker on the lateral side. Our patient is shielded. And what are her breathing instructions? Just to hold still. Okay. So what we were talking about just a second ago with the centering, make sure that you're centered appropriately so that when you collimate, you're not collimating off either the calcaneus here or opening your collimation so much that you have light on the table up here. Okay, so the question was asked about where the central ray exits. The central ray is actually going to exit just posterior to the lateral malleolus. So if you notice where this is kind of intersecting, it's a little more towards the patient's head, which is a little posterior from that lateral malleolus. And that's where you want your central ray to exit. Okay, so we are going to do the lateral now, the lateral calcaneus. We've moved our CR back to perpendicular and back to a 40-inch SID. We still have the 10 by 12. We can do length or crosswise for this one. We're going to collimate everything off, so we can, either way is fine. So we want the patients rolled up onto their side of interest, okay? So we'll roll her up, which she's already done. Her leg can and should be bent 90-degree angle here from the lower leg. So we've dorsiflexed her foot to 90 degrees. We want to make sure that we center her calcaneus, because this is what we're looking at now, to the IR. So I'm going to lift her up, scoot her over, pull my marker out of there for you. Okay, and now we need to center to where? Where are we centering for the calcaneus?
1 inch inferior. 1 inch inferior to the medial malleolus.
Yes. So we find the medial malleolus and we go 1 inch inferior to that. So 1 inch for me is about 2 fingers. So I actually need to come up just a tiny bit, but I was pretty good there. Okay, and I'm going to come forward a little bit because we just want to go directly down from the malleolus, not posterior. Okay. I'm going to leave my collimation open so that I can line up my CR and my IR. Okay. Marker can go posterior this time, okay, because we are going to collimate off this anterior side. So we have her foot dorsiflexed. We also need to make sure that this lateral portion of her foot is touching the IR. Okay. One thing that we talked about with ankle and with foot is either over rotation or under rotation. If your patient's knee is up, their foot's going to come up. If their knee is way down, their ankle or their heel is going to come up. We have to make sure that this whole lateral side is touching the IR. Okay? So now we can collimate since we know that everything's touching. We include the tarsals here. I'm getting close back there. Okay, we've got our marker in here. It's not in the shadow, it's not in the anatomy. Okay, our patient is shielded. What are her breathing instructions here?
Hold still.
Just to hold still.